I'm Johnathan Bronson. I'm a Maryland state licensed acupuncturist. I've been helping people with addictions for the past 10 years, 4 as a student and 6 as a licensed practitioner. And that people who stay with it, just like with recovery in general, really tend to benefit from it. And sometimes people need multiple treatments before they start to really notice the difference. And that's okay. Sometimes people get a treatment one time and they already start to feel different. Sometimes you need that steady, repetitive comeback and this physiological reminder that you can be different. And it's truly amazing to see how people can change their lives with this modality in coordination with conventional methods. Originally, I was a patient of acupuncture. My first encounter was when I was somewhere between 12 and 15 years old. I had some kind of anxiety going on with my life at that time. I ended up going to see my first acupuncturist, and I got the needles put in by my acupuncturist, and I never recovered in the best possible way. I wanted to find out how to do this myself from early childhood. People come in with a particular ticket, and in this case, it's addictions. And then what we uncover through a conversation is that, yeah, it's addictions, but why? And we start to find out that, there's this history of some kind that is also important to treat alongside with the addictions. And it's true with knee pain too. Sometimes people come in and they say like, my knee really hurts. But then we go a little bit deeper and we find out, well, why does it hurt? And sometimes the answers are very mysterious. Sometimes it's very simple. And so I like to meet people exactly where they are and try to meet the needs that they have. In terms of sort of how impactful can this kind of treatment modality be, one person stands out who was at a stage 4 of a particular kind of cancer. And her treatment design at that time was how to deal with the pain. And when I was treating her, both with acupuncture and acupressure, she noticed a much less pain, more than any of the pain meds that she had been taking. She noticed that she had more cognition, and she was more easily able to walk down the hall. And there have been a couple of severe cases like that where people notice some pretty dramatic changes even if they have some kind of recalcitrant disease process they're going through. What the ancients were able to do is figure out how the organ networks, internal organ networks, correspond to those functions. And that furthermore, there are pathways that connect through the soft tissue network to all of those organ networks. So when I stick a point in, I'm actually impacting the functioning of one of those powers of storage, growth, maturity, decline, through the organ network, through the pathway. And disease is when one of those 4 things is happening too much or not enough, or the transition isn't happening smoothly. So that's the lens that I operate under, and how I might choose a point is, let's say the function of growth is compromised. I would ask the question, why? And then I would make an assessment by feeling your pulse and looking at your tongue that also correspond with those organ networks and those functions. And then I would choose a pathway, and then I would choose a point. All of ancient Chinese medicine hinges on those 4 major powers plus their transitions. So whether you're using acupuncture, whether you're using herbs, whether you're using a conversation, whether you're using a movement modality, those are all ways in to helping correct those functions. It's one reason why I like to do sort of talks about what I do as well, because it helps to contextualize what I'm doing in one way, but then in another way I can make the offering through language. I would. That's one of the things that we know for sure happens with acupuncture, is that it creates an immune response, even at the level of just having a needle inserted into a clean site. So yeah, for sure, you can use acupuncture to boost your immune system.